I want to talk to you about atelectasis, which we commonly see in clinical practice. And here's the case. A 62-year-old man is dyspneic about 24 hours after he underwent a cholecystectomy. His respiratory rate is 22, his pulse is 112, he has mild fever, and decreased breath sounds are noted on the left lower lobe. His white cell count is 27,000. So here it is. 24 hours he has dyspnea after he underwent cholecystectomy, right? He has shortness of breath and he has decreased breath sounds on the left lower lobe, and he has a leukocytosis. So this is the typical patient we get. Now right away you should think about, well, you see the leukocytosis and the mild fever and you say, wait a second, maybe he's got an infection. But surgical infections usually don't occur before 2 days after the surgery. So 24 hours after the surgery, this is too quick for a surgical infection to occur. And unless the patient has been in the hospital before, it's likely that this is not thromboembolic disease. You could say, wait a second, maybe he had thromboembolic disease after the surgery, because he was in bed all the time and stuff like that. And thromboembolic disease causes dyspnea, and you may get some decreased breath sounds on the left lower lobe if you have an infarct, right? And you may get some leukocytosis, but usually a cholecystectomy now is an elective thing. Patients come in the night before in the hospital, and they undergo the cholecystectomy. They stay the day, after, and then they go home the day after. So that, unless this guy has some other reason that they're not giving us in the history, I wouldn't suspect a pulmonary embolus either in this patient right away. What I would suspect is something that commonly happens within 24 hours after the surgery, and that's atelectasis. And atelectasis is a collapse of part of or the entire lung, depending on